Hello YouTube, I'm Dr. Fox. Today, I'm gonna talk about IUD or intrauterine device. An IUD is one of a group of contraceptives known as long-acting reversible contraception or LARC. It's a small device made of plastic and copper which adductor inside through your cervix up into your uterus womb. A couple of threads attached to the end of the IUD hang out into the top part of your vagina so it can be removed. It's sometimes also called a coil or copper coil. There are two types. Some give 5-year protection against pregnancy and some give 10-year protection. After that, you have to have a new one put in or use a different form of contraception. So, how does it work? It works by releasing copper into your womb. The copper changes the cervical mucus, so it is much more difficult for sperm to reach an egg. And if an egg is fertilized, it is much less likely to implant itself in the womb. So how effective it is? It's very effective. If women do not use any contraception, between 80 and 90% will become pregnant within a year, but fewer than 1% of women with a coil will become pregnant in 1 year, and fewer than 2% women with a coil will become pregnant over 5 years. As with all long-acting reversible contraceptions, it is partly so effective because you don't have to remember to use it or take it every day or every time you have sex. But remember that, as with any other contraceptive, its effectiveness will vary with your age, how often you have sex, and whether you use it properly. Okay then, what are the advantages of using an IUD? There are several advantages, but the big one is that you don't have to think about it before or during sex, like you do with condoms or the cap. It also gives long-term protection, either 5 or 10 years, depending on the type you have fitted, and it starts to be effective as soon as it is inside you, so you don't have to wait. It doesn't have any hormonal side effects, like headaches, aching breasts, or skin problems that you can get with some other methods of contraception, and you can also safely take other medicines while you are using a coil. It has no effect on your weight, and it doesn't put you at increased risk of cancers of the cervix, uterus, or ovaries. Lastly, as soon as you have it taken out, you can get pregnant again. On the contrary, what's the disadvantages? Women react to having the coil in different ways. Some women find their periods are heavier, longer, or more painful, although this usually improves after they have been using the coil for a few months. Occasionally, women get bleeding and pain in their vagina. If this goes on for a long time, the doctor may prescribe you a medicine to help and will check to see whether it is due to something else, like an infection. If it continues, you can have the coil taken out and use a different method of contraception. One important disadvantage to consider is that it does not protect you against sexually transmitted infections or STIs. So depending on who your partners are, you may also need to use condoms. Also, there's a small possibility that you will get an infection during the 3 weeks after an IUD is fitted. Furthermore, it very occasionally happens that when the IUD is put inside you, it makes a hole in your uterus or cervix. This will heal by itself but be painful at the time, and you will have to have an operation to remove the IUD. Then, you may wonder who can use an IUD. When you go to a doctor, your doctor or nurse will ask you a few questions to check the IUD is the best contraceptive for you. Tell them about any illnesses or operations you have had, as although they may not mean you can't use an IUD. You can use an IUD after you have had a baby, but either it has to be inserted within 48 hours or you have to wait for weeks. In some hospitals, doctors will fit an IUD at the same time as a vaginal delivery or cesarean section. They can also do this if you have a miscarriage or abortion, so you have immediate protection afterwards. If you don't have this done, wait until 4 weeks after giving birth to go to a doctor to have the IUD fitted, and be careful to use another type of contraception until then if you have sex. If you are breastfeeding, Having an IUD fitted won't affect your milk. However, you should not use one if there is a possibility you are already pregnant or if you have an untreated STI or pelvic infection. Signs of a possible infection are pain in your lower abdomen, a high temperature, and a smelly vaginal discharge, and you should see your doctor if you have any of these. If you have very heavy periods, or if you bleed during sex or have any medical history of problems in the vagina or cervix, tell your doctor or nurse as the coil may not be suitable for you. Okay, next, how it is fitted. You have to go to a doctor to have an IUD fitted, as specialist staff have to do it. You will have to make follow-up appointments. Before fitting it, the doctor will check inside your vagina to see how large your womb is, and if they find any STIs or other infections during the check, you will be given antibiotics. You should expect the appointment to last up to 30 minutes, but it doesn't take more than about 5 minutes to fit the IUD itself. The doctor holds your vagina open like when you are having a smear test and inserts the IUD up through the cervix. This can be done at any time of your menstrual cycle. It can be a bit uncomfortable, but you can discuss having a local anesthetic with your doctor. After the IUD is inside you, you have immediate protection against pregnancy. You may experience some cramps, like during your period, and a little bleeding in the next few days, but over-the-counter painkillers usually deal with this. Over the first few months, you should regularly check that the IUD is still in place, especially after your period. Your doctor will tell you how to do this when it is fitted. You have to feel for the little slits which hang up down into your vagina. If you cannot feel them, or if they have changed position, you may not be protected against pregnancy, so remember to use additional contraception like condoms. If you have sex before you can get to the clinic for a checkup, and take emergency contraception if you have had already sex. You should also go back to the clinic if your partner says he can feel the IUD while you are having sex. You also have to go back to the doctor 3 to 6 weeks after the IUD is fitted so that they can make sure everything is working properly. You can tell them about any problems you are experiencing then, and if necessary, you can get the IUD removed. Okay, next. How is the IUD taken out? You need to go to the doctor to take the IUD out. They will gently pull on the threads to remove it and then talk to you about your options going forward, for example, having a new IUD fitted or using some other form of contraception. You may wonder, does using an IUD affect your fertility? My answer is no. As soon as it is taken out, you are as fertile as you were before you started using it. Your periods will return to normal, and if you don't want to get pregnant, you must start using another type of contraception immediately. If you do want to get pregnant, you should follow all the usual pre-pregnancy recommendations, like taking folic acid supplements, eating healthily, and not smoking. Question: can you use tampons if you have an IUD? My answer is yes. You can use tampons and menstrual cups. Just be careful not to pull on the IUD threads when you take the tampons or menstrual cup out. Otherwise, you may dislodge the IUD. Last question. What should you do if you are using an IUD but you think you have got pregnant anyway? This is fairly unlikely, but if it does happen, you need to see your doctor to discuss your options. If you want to continue with the pregnancy, the IUD should be removed as soon as possible. There is also a small increased risk that you will have an ectopic pregnancy, which means the egg develops outside the uterus, usually in a fallopian tube. Warning signs of this are a sudden or unusual pain in your lower abdomen, so if this happens, see a doctor straight away. Okay, thank you for watching. See you soon.